I'm going to swing it over. So the first one that I decided to put in here is around co-occurring medical conditions. And I touched on this in some of the previous webinars, but it really is something to have at the forefront of our minds, even with talking about sleep. So co-occurring, that term, it just means at the same time. So it's someone that is ADHD and also has a medical condition at the same time. And this is really, really prevalent. Some other neurodivergent friends and I actually last week were in a group Zoom and something got said. We were discussing a friend of ours that was having surgery, and we were saying, gosh, are there any of us that don't have a medical condition or chronic illness? And we were scrolling through our friends on social media and going, I can't think of anybody that doesn't. And obviously if we're the adults that are neurodivergent with these medical conditions, we were children with them, or many of us started with these as children and sometimes didn't get it recognized until we were adults. Despite that, we had a lot of pain as kids as well. So I just wanted to bring it up because it's something to be thinking of if a child's struggling with sleep, that assessing for pain, including dental pain, is really high at that list. And you can do this with some different, if you're not quite sure, there's some different tools that you can find online. There's one called FLACC. It's FLACC. Yes. And it's just to help you with looking at the young person and kind of trying to suss out, are they in pain? And so the F stands for face, maybe they're grimacing or tightening their jaw. There's also legs, like a lot of movement around. That's also tied with A for activity. And then we're also thinking about, are they crying? C, and then are they able to be, are they consolable? Are we able to provide support with that movement goes away? So there's a lot of things you can look at online to help try to decide, is this person in pain when they're sleeping? And of course, if you think there's any pain, to make sure to talk to the parents and any relevant medical providers. Let me just move this real quick so I can see the rest of my slide. Oh, medications. Well, where there's medical conditions, there's medications. And sometimes these do affect sleep. Sometimes they're in that tiny, tiny writing. And sometimes someone might forget to share that, oh, this medication that they're on might affect their sleep, especially if there's multiple medications. So it's a good time to say to the parents, maybe we should take them all out and have a look at them, or maybe they need to go in and talk to the medical provider and assess that again. I put anxiety as its own separate one. And of course, anxiety actually is quite the theme going for the whole webinar, and it can be for so many reasons. It really just points to being really, really curious, because the box below it talks about this idea of rest and digest comfort. So they're kind of tied to this next point I want to make, is when we're going into sleep, that's the side of our nervous system, that parasympathetic nervous system. So it's the rest and digest system. And when we go into that mode, that's when our digestive system, that GI system, is a bit more active. And so what can happen is someone might be doing pretty okay. And then actually when they go into more of that sleep mode, their digestive system, if they have something that's like on the left, we have so many connective tissue disorders, and they really affect our GI system. So if a kid has that and now going into sleep, we might be seeing pain that they didn't have during the day, and now it's presenting at nighttime. And that can be a bit confusing because obviously little people struggle to make those connections and struggle to communicate with that. So what we see instead is just that bedtime refusal, and just that anxiety and maybe anger and crying. So again, unfortunately, it's really a tricky one to start to suss out, but it is something to, take seriously, really suss out, discuss with the parents, encourage maybe having a discussion with the doctor of this child's presenting with a good amount of anxiety and pain at nighttime. And we're concerned that maybe there's something else, an underlying medical condition, because it is quite common for us.